Welcome to Changing Higher Ed, a podcast dedicated to helping higher education leaders improve their institutions. With your host, Dr. Drum McNaughton, CEO of The Change Leader, a consultancy that helps higher ed leaders holistically transform their institutions. Learn more at thechangeleader.com. This episode of Changing Higher Ed is sponsored by Ptsd Education, a national leader in online student recruitment and enrollment services, providing institutions enrolled students risk-free on a performance-based model with no long-term contract. If your online programs could benefit from incremental online student enrollments, visit ptsdeducation.com. That's PERDIA education.com. And now, here's your host, Drum McNaughton.
Thank you, David. Our guest today is Dr. Tom Mars, Assistant Director of Texas A&M's Center for Executive Development. Tom has spent 14 years at A&M as a faculty member, employee training and development specialist, and in a clinical role as a psychologist at the Employee Assistance Program, where he provides counseling and consultation services to over 10,000 Texas A&M employees and their dependents. He's also served as a National Olympic Development Team coach for 14 years and is a 2-time world champion and 5-time All-American team member in shooting. Dr. Mars is an expert in workplace behaviors, motivation, communication, stress management, conflict, and interpersonal aspects of management. And we welcome him back to talk about how higher ed can deal with the stress that can result from either being affected by COVID or having someone close to you having to deal with the disease. Tom, welcome back to the show.
Thank you very much for having me. It's a pleasure to be here.
It's great to have you back as well. We had such a great conversation last time, and this is going to be a continuation of that. I mean, we've had a bad year. Let's face it.
It has been.
Last year was 2020 was absolutely crazy. And the impact of COVID on the faculty's employees has been huge. We've got folks coming back to work and, people are exhibiting what a layman like myself would say, PTSD. And it's really crazy. So what's going on with employees, and what can we as higher ed leaders do to help them and to really get them through these challenging times?
Well, to start with, you're right. There's so many challenges that exist now, many of which we've never really had to deal with before, and they continue. Each day we have some solutions to some problems that have come from COVID, but we're introduced to some new problems. So we have the possibility of a vaccine, the reality of a vaccine, but now we have to deal with a large segment of the population that's vowed not to get the vaccine. They don't trust it. There's trust issues. There's a distribution and logistics problem with it, timelines, plus the fact that things are trying to right themselves. The ship is trying to right itself in a world that is very changed. And this actually is not the first time I've heard the dreaded four-letter word brought back, PTSD. But I think that's certainly something warrants more discussion.
Well, I agree. And, we've got employees coming back. They've lost loved ones. They've lost friends. They've lost work colleagues. This situation is different than pretty much anything we've seen in our lifetimes. Maybe World War II, where folks experience these type of things. But PTSD is one of those animals that we know the buzzword, but I don't think we really know what it is.
I agree with you. And I see that term being used very frequently in social media and even within our news agencies. And for myself as a psychologist, I hear that word very differently. And I think that for your listeners, it's important perhaps to sort of flesh out the differences between a clinical term like PTSD and a clinical approach to what do we do about this versus a non-clinical approach. PTSD is a clinical term that has a very specific set of diagnostic criteria. I think a lot of times what I've seen is that people use the term PTSD because it is known and there are a set of assumptions about what that means. A lot of times people use that term to validate to others how severe their symptoms feel.
And when you say symptoms, what do you mean?
The symptoms of PTSD that are really stress-related. PTSD, like the other stress-related disorders, are a stress reaction. It's a very profound stress reaction, but there's always some element of struggle or to function in social situations, interpersonally, developmentally, educationally, occupationally, and even physically with how we're doing physically. So I think that all of those factors are sort of piled onto that general term PTSD as a way of having a common language, right? We all know if I say I have PTSD from this, we all know that it's from something really bad that has happened, that I've witnessed or I've experienced. But for me, that applies a clinical pathology to something that is really non-clinical.
Okay.
That is better explained by normal human reaction to a very stressful situation. Absolutely. In fact, if I can, one of the definitions in the newest Diagnostic and Statistical Manual, the 5th edition, it specifically calls out medical conditions as part of the diagnosis and excludes them from one of the causes of PTSD. It says a life-threatening illness or debilitating medical condition is not necessarily considered a traumatic event. Medical incidents that qualify as traumatic events involve sudden, catastrophic events such as waking up during surgery or anaphylactic shock, that sort of thing. So it specifically excludes that. But again, what people are getting at with that term is that common feeling of how severe this feels and how it's impacting our functioning even more so.
So let's approach it from that perspective. Folks have been under tremendous stress for multiple months. I mean, it's coming up on a year now that COVID has been around, shutdowns, etc. They've been working in environments that are very, very different than what they're used to working at.
Right.
You know, many folks working from home. And then with friends, with work colleagues, even family who have been diagnosed and even potentially died from COVID, this certainly is an issue or will be an issue going forward.
Absolutely. And I think that the real impact on people's physical health, their psychological health, their emotional well-being is yet to be seen. Because one of the key components to diagnosing someone with a disorder, a stress disorder, is cessation of the thing that is causing the stress, right? So we can't make an accurate diagnosis if the stressor is continuing. All of the stress disorders begin after the cessation of the stressor. So we're still in it. And then we have to deal with what about if the risk of COVID goes away, right? We have a vaccine, but now we have a new intense stressor with the economic conditions. We haven't seen all of the impact of this economically, I think, yet, and the health symptoms that are going to follow this, and our way of doing business, our way of life is changing profoundly as a result of this, and that's going to bring more stress. So I think what we first have to do is let the dust settle a little bit. Once the immediate risk of COVID starts to subside, people will have a natural tendency to move back to homeostasis, right? They will try to move back to what they know to get out of that stress. And for most people, within 3 to 6 months, they will return to normal functioning. It doesn't feel that way when you're in the middle of the stressor, right? You feel like it's going to always be this way. I now have an anxiety disorder. I have PTSD. There's something wrong with me, because you don't see an end to the stressor. But once it does end and it's a known quantity, people will very quickly start returning to normal, and they will start functioning better, as it were. But to me, at least, Drum, that's the difference between applying a clinical examination of the symptoms that people have versus a functional definition, a non-clinical examination of this, which is how people feel and act under stress, under really severe stress.
Mm-hmm. And people are, at this point, there's many folks out there who are saying, I do not want to go back to work.
Right.
I am too afraid of this disease. I've lost family members. I've lost friends, etc. I really don't want to do this. Now, of course, that flies in the face of so many people having traveled over the holidays. But be that as it may, folks are afraid of this, and that's bringing up even more stress. So,
right.
What's the best way for university presidents to deal with these kind of things coming forward? I mean, you've got a large population of faculty, of employees, whatnot, who potentially are going to be coming back to work sometime in spring term. How do we deal with these things?
Well, that brings up an analogy in my head of when I was in graduate school. My first practicum was within the prison system here in Texas. It was a very interesting first practicum in psychology in a men's medium security prison system. And I was told by the unit psychologist, almost 100% of the inmates here are diagnosable with an adjustment disorder. And an adjustment disorder is basically a very high functioning level of PTSD. And it comes from being exposed to a new novel situation that's highly stressful. It's out of the ordinary. It overloads them psychologically, and they start showing signs of PTSD, very similar to what we're seeing with the pandemic. And as he put it, my unit psychologist put it, I hope they have adjustment disorder, because it scares me to think that anyone is in this prison and is adjusted to this and doesn't have difficulty sleeping and functioning in a prison setting, because that means they're institutionalized.
So what you're telling me is bringing folks back to school is like putting them in prison. Is that what you're saying?
It's very much like reintroducing inmates back into society, certainly. And how do you do that? How do you prepare them to go back to some semblance of normality when they get out of prison? And if we're in COVID prison, how do you reintroduce people? And what we know is that happens very naturally on its own as people sort of find their sea legs again. They find that they can still do things the way they're used to, or they can find a new normal, and that will feel safe after a while. And that's what's going to happen, I suspect, for most people, the majority of people, is they will return to a sense of security and safety in the new normal. And that will happen automatically. But there will be a contingency of people who struggle, who continue to struggle with this moving forward, that they don't get rid of that adjustment disorder. Honestly, we have more to worry about with that, with older employees and older faculty that are more set in their way and have had difficulties pivoting to a virtual environment, to the new order of things. We likely are going to see more symptoms from them.
Well, I understand exactly what you're talking about whenever and I spent a lot of my career in the Navy outside of the U.S., lived outside 3 years in Spain and traveled throughout Europe, and then 4 years out in the Far East, traveling throughout there. And each time I would come back to the U.S., I had to adjust. It did not feel like home for me.
Yeah, and that's something very similar will happen again with this population. You will see people trying to figure out how to behave under the new rules. And I know that even for me at the Center for Executive Development here at Texas A&M, this has required a complete pivot in our business model. And we're now in this sort of purgatory of how much money do we put into changing the infrastructure of how we do business, not knowing how much of this is going to become moot and go away when we return to, quote, business as usual. So it calls for some difficult decision making. And I suspect your listeners are struggling with the same decision set. And that in and of itself causes a lot of stress and stress reaction.
Well, it's certainly a very challenging time for them, with folks coming back to school, back to campus, whatnot. There's been a tremendous amount of focus on students, but not a whole bunch of talk on the employees and the faculty perspectives of all this.
Right.
Can you talk to that a little bit?
Well, I think that the things that stand out to me are the economic impacts that this is going to bring. Obviously, that's something we worry about particularly with staff, because your staff tend to be in the lower pay brackets, the lower compensation brackets. And so they may be disproportionately impacted by the economic damage that's been done by the pandemic, and being aware of that. In addition, the fear reaction, right? So if this looks and feels like PTSD because of how traumatic it feels and what a shock to our system it is, people develop a fear reaction that is palpable, and you will see it in the workplace. And now you have behavioral issues to deal with within the workplace. And they're going to bring that back with them to the workplace. People, I've heard it said by many people, I just hope I don't lose my job. I'm just really happy. I'll deal with all of this. I just don't want to lose my job. And that's where leadership at the university can really make a difference. That's where they stand to have the biggest impact on people's functioning, is how they handle that stress reaction and those fear reactions.
Yeah. So those fear reactions, what is that going to manifest like? How can university presidents, HR directors, how can they understand that it's not just a bad employee acting out, it's just a, quote, normal reaction to all the stress that they've been under and are currently still under?
Well, I think the first thing is to try not to pathologize behavior. I mean, you're going to continue to have personnel issues regardless of the situation with the pandemic. You still have people working for you, and there's going to be good employees and poor employees, differences in performance, but not jumping to pathologize people's behavior, particularly when you have a baseline. This employee has always been a really good employee, and now all of a sudden they're showing up late to work. They're not responding in a timely manner. Their quality of work has decreased. You have a choice in how you treat that. You can treat it as this sudden onset of performance problems, or you can look at it as they have PTSD and I need to send them to the employee assistance program immediately. Or you can look at it as this is what adjustment disorder looks like. This is what critical incident stress looks like. This is what people look like when they get under stress for a long duration. They start becoming more depressed, anxious, that sort of thing. And you can approach it from that standpoint. How can I cut them a little slack? How can I talk to them about what they need and be a good leader under those circumstances to get the best from my people? It's a little different approach.
It sounds like it's one of those things almost analogous, and I may be making a mistake here, but I'm going to go for it anyway. It sounds like something that you would see military members experience in World War II or in a long conflict, Afghanistan, whatever, where they're there so much and that becomes normal. And then finally, they no longer have the ability to download all that stress, and it just piles up on them. Is that a reasonable analogy?
It is within boundaries. So we think about one of the primary populations who experience PTSD as military and police, anyone who deals with severe trauma and are re-exposed to that trauma on a regular basis. And the reaction from employees, faculty, and staff look very similar to that. One of the things that I would say differs is in the military, there's actually a very low percentage of soldiers who will get PTSD, given the number that experience severe trauma. And the reason is because what do they do in boot camp? They expose you to a lot of those traumas to inoculate you. They tell you what you're going to see and how to deal with it psychologically. They expose you to it in a sort of a safe manner to inoculate you for the horrors of war. We don't have that with the general population. So people are not prepared for what has happened and what they've been exposed to. So you see more analogous behaviors from faculty and staff to military and to PTSD, partially because of that. There hasn't been that inoculation. So what can leaders do? Well, what do they do in the military? To try to normalize it, to try to be empathetic, to listen to the employees, to understand where they're at, to take care of yourself. You're of no use to anyone in a leadership position if you don't take care of yourself as well and realize that the toll it takes on you as well.
That's so critical. And I know that was one of the points we brought up when you were on the show a few months ago, is leaders have got to take care of themselves.
Right.
If you're not taking care of yourself, there's no way you can take care of your people. And the university president role is no longer an 8-to-5 job, not that it was before, but under these periods of COVID, this change, it's 24/7. There's probably no more difficult role in the U.S. other than possibly President of the United States that can expose you to that midnight telephone call, that or medical profession.
Absolutely. Absolutely. And in that same vein, to not pathologize it for yourself, because you will listen to yourself. And if you tell yourself, this is terrible, this is horrible, this is awful, I have PTSD, then that's how your body will respond to it. So cut yourself some slack. Understand if you are in a leadership position, it doesn't feel normal, but it is a normal response under a lot of duress to have difficulty making decisions, for your sleep to be disturbed and not get enough sleep, or to want to sleep all the time and be tired, to have nightmares at night, to get stuck on things and ruminate on it, where you think about it all day long over and over again, to start avoiding social situations. The human body is very adaptive. It's very good at knowing, hey, we're stressed out. We're going to go ahead and shut down for you now to try to get some of this stress off of you. So one of the ways it does that is to make you depressed. When you're depressed, you don't want to go do social things. You have anhedonia, a loss of pleasure in things you normally find pleasurable. Hey, Drum, you want to go to the movies? No, y'all go ahead. I don't really feel like going. Y'all go ahead. You suddenly don't want to go do anything. And it's because doing anything other than sitting still on my couch for a little while feels like another stressor.
So what I'm hearing you say is drink more coffee.
I don't know. I don't know if that would would help or exacerbate the anxiety, but that's certainly a natural reaction to people. I'm tired all the time, so I'm gonna. People do increase the amount of alcohol intake. That's for certain.
Is not good because that's a depressant.
Yes, absolutely. But weight gain, all of the things you see associated with depression and anxiety, you start to see. And that stems from, we have to be clear, that starts with your own pathologizing of it, saying something is wrong with me. I'm not dealing with this well. I'm not coping. Your body listens to that. If you go, yeah, this really stinks. I really don't like this. But you know what? I'll get through it. I need to slow down, take a little time for myself to recharge, come back at it. That allows you to go, okay, maybe this is just temporary then. Maybe this isn't so horrible.
Yeah. Well, it seems like it's been going on forever. And
Yes,
so
it does.
it's very, yeah. So it's like you keep telling yourself there's an end to it. And I think the vaccine being rolled out is certainly going to help in, quote, normalizing things or getting things back to a new normal. But in the meantime, people need to take care of themselves. As a leader, you have to set that example. And one of the examples that you can set is taking care of yourself and letting people know that you're taking care of yourself. And it's not one of these do as I say, not as I do type of things. We've seen too many examples of that, of, oh, stay at home, but I'm going to go to the French Laundry for my Thanksgiving dinner. That's probably not a good idea.
Right.
Sorry about that, California. And that's only one example. Austin's mayor had the same kind of thing as well.
Oh, it exists everywhere. Yes.
Oh, it does. I can remember back in the military, if you'd have to go to the commissary or the base exchange or whatnot to get something as an officer, you put on nice clothes. You didn't go there in cutoffs and jeans and stuff like that, because if one of your troops saw you, you lose respect.
Right.
And so people taking care of themselves is critical. You need to do it yourself, and you need to have your people doing that.
And that brings up another point, Drum, also that I think is really critical in this, is that when people are under stress, they look to people they respect and people in power for direction. I liken it to when a child falls down and bumps their knee, a toddler. If the parent doesn't react, the parent just looks at him and says, "Are you okay?" The child will stand up, dust themselves off, and continue on. If the parent reacts really strongly, like, "Oh my gosh, are you okay? Oh, you poor thing," and gets really upset, the child goes, "Oh, there's something really bad about this. I have to react to this. This must be horrible." And they start crying and screaming, right? So they look to the parent to determine how to react in the situation. And that happens in a leadership followership situation as well. So be very careful about the language that you use when talking, sending out emails to your faculty and staff that allow them a way to feel normal, allow them to be okay with this, and to feel your empathy for the situation, that you're struggling as well, but you're trying to take care of yourself, and you suggest the same for them. They will respond much, much better to that, and it will make the return to work much easier.
That's great advice. So, Tom, we're coming up to the end of our
Sure.
time. It always goes by so quickly when we get together. So, 3 takeaways for university presidents. How do you deal with people coming back to work and the situation as it is?
Well, I think that obviously the first is to help people not pathologize their reaction by being careful of the language that you use. During times of stress and change and flux and uncertainty, we should increase the rate of flow of information, but oftentimes what happens is it decreases. So stay in touch, keep communicating with your people, be positive, and use intention with the language that allows people to feel okay and feel normal. I think a second one is to not make decisions based on assumptions that things will go back to normal, nor that the world is ending and this is going to be terrible and horrible and awful, but more that this is a severe but temporary condition. This is terrible. It has been very life-altering, but it's temporary. So have room in your decision-making to kind of see what's going to happen. Don't do anything rash. And I think the third thing that comes to mind for me is don't overlook opportunities that you have as leaders to increase support for your people, to increase support services temporarily, where you can get the most return on investment. If that's paying your people to have more sessions at the employee assistance program, for increasing funding to programs for financial assistance to people, for increasing support at daycare and healthcare services on campus. Wherever you have the opportunity to make a tangible difference, certainly to look at that, because that makes a big difference when people are under this much stress.
Oh, those are great takeaways. Thank you. So what's next for you in the Center for Executive Development?
Well, I think similarly to everyone else, we're trying to establish some sense of normality in what 2021 is going to look like. And we have a new facility here that we have installed on campus for doing virtual programs. And we're now trying to decide, was it a good investment? Because are people going to immediately move away from virtual learning as soon as this is over? So it's sort of the same situation. We're trying to see where to from here and what is the new normal going to look like.
Aren't we all? So.
Yes.
So, well, Tom, it's always a pleasure, and wish you the best going forward. And I know we'll be in touch.
I appreciate it very, very much, and I look forward to it. And I wish the best for all your listeners as we move forward into unknown territory.
Take care, my friend.
Thank you so much. You as well, Drum.
Thanks for listening this week, and a special thank you to this week's special guest, Dr. Tom Mars, and for his sharing his thoughts on what university presidents can do to help employees and faculty with the onboarding and welcoming back process, especially those employees and faculty who've been directly affected by COVID. I also want to give a special shout out to our sponsor, Perdea Education. Visit PerdeaEducation.com to learn about how they can help grow your online student enrollment through a performance-based model with no risk or long-term contracts to your institution. Our next guests are Jay Patel and Steve Ferguson, two entrepreneurs who have developed a new way for graduates and students to more quickly pay off their student loans. This is a new way of doing things, folks, and I suggest you tune in for this one. It ought to be good.
Changing Higher Ed is a production of The Change Leader, a consultancy committed to transforming higher ed institutions. Find more information about this topic, along with show notes on this episode at changinghighered.com. If you've enjoyed this podcast, please subscribe to the show, and we would also value your honest rating and review. Email any questions, comments, or recommendations for topics or guests to podcast@changinghighered.com. Changing Higher Ed is produced and hosted by Dr. Drum McNaughton, post-production by David L. White.